What will home health nursing look like in the year 2030? In the year 2030, everyone will have a smart device. In 2030, portable sensors will evolve from Fitbits and wristwatches to small devices that can be adhered to the skin like a Band-Aid. Contact lenses will also be available that can measure eye pressure. In 2030, I will be able to make virtual visits to my patients. This, combined with the ability to obtain patients' vital signs via a remote monitoring device, will eliminate the need to drive to a patient's home to perform an assessment. I will be able to see many more patients with this technology. I will also be able to conference in with other members of the healthcare team or caregivers. I will no longer have to drive to a patient's home to draw blood, then drive to the lab to drop it off, and then wait 24 to 72 hours for the lab to run the test. Lab-on-a-chip technology will allow patients to place a drop of blood on the chip and insert the chip into a smartphone. The phone will read the assay and deliver the results to the physician and myself immediately. In the year 2030, I will have an assistant. The virtual nurse is an avatar that interacts with the patients using video technology on a smartphone, smart television, or computer. The avatar can ask the patient simple questions, or if I program the avatar, it will be able to answer a patient's questions as well. The avatar software will also collect data from other medical devices that my patient uses, such as laboratory test applications or wearable monitoring devices. Reports will be sent to myself and the attending physician. The avatar can also capture gestures with a Kinect, for example, to assess a patient's range of motion. This feature will reduce the amount of visits needed by therapists, as the avatar will be able to guide the patients through a home exercise program. In the future, service robots will be available for use in the home to provide custodial care, such as carrying or turning patients, administering medications, and performing general housekeeping duties, such as laundry, cleaning, and food preparations. I will be able to program the robot to complete the tasks that are required. In 2030, home health nurses may not have flying cars, but the advances in technology will allow them to see more patients through the use of video technology and to obtain real-time data to facilitate timely interventions. This will all lead to better patient outcomes.